I'm pleased to be joined today on Health Beat by Physician Assistant Katie Wood with Faith Regional Physician Services Family Medicine. And we're talking about strep throat. So what are the common signs of this infection and how do you treat it?
Kids with strep throat usually come to the clinic because they have just a sudden onset of sore throat. They have swollen lymph nodes in their neck, usually on both sides. They don't normally have a cough, runny nose, or other symptoms of like a viral upper respiratory system, but most often they also come in feeling very tired and have a headache. There are also times where people have came in only with like abdominal pain and a headache. They can have nausea and vomiting or nausea without vomiting, and I will swab them for strep throat and it's positive. So even if your kids just have a headache and abdominal pain, think strep throat. That might be one of the causes. However, those are for like normal kids. When you think infants and toddlers, a lot of times they present with a thick, purulent nasal discharge. They aren't eating or drinking because of the pain, and they're just kind of overall fussy because they have a lot of times a low-grade fever.
Sure.
A lot of times people think the classic symptoms are, you have the white, grayish exudate on the tonsils, and sometimes you see red to purplish dots on the back of their palate, which we call petechiae. Those can be signs of strep, but they also can be signs of certain viruses. So just because they have those doesn't mean they necessarily have strep throat. You can also get a rash, scarlatina rash, with strep throat. It's usually a red rash, kind of papular in nature. When you press on it, it blanches, meaning it turns white, and the texture is best explained by feeling like a fine sandpaper when you rub your hands on it. Treatment for strep infections is penicillin because that remains the first-line drug of choice for it.
And that's Health Beat, brought to you by Faith Regional Physician Services.